64-year-old Bernadette McCafferty developed severe, life-threatening asthma over the last 7 years.
The severe asthma, you could be sitting quite well one moment, and then it's like a flick of a switch. You go rapidly. It's scary because you're opening your mouth and there's absolutely nothing going on. Nothing.
Early in 2019, Bernadette suffered a major attack.
I was very ill and I was in hospital and took a turn for the worse. Dr. Olga said, we need to send for your family. It was my eldest granddaughter's birthday that day. I can remember saying to Dr. Olga, don't let me die today. I'll die tomorrow if you like, but please keep me alive today because I'll destroy her birthday. Just the rest of her life, just keep me alive today. I had several spells in hospital with really long recovery periods. And so I just had thought, there's no way I can see old age with us. I spent a lot of time with the GP talking about my life. And I said, look, realistically, my body can't take this much longer. And so we did what's called an advanced directive. It's something we do in hospitals or care, but it's usually at later end of life. But I wanted to make sure that my children had no decision to make, that if there was a life support machine, it was to be switched off.
Bernadette is in the care of Dr. Olga Mikulich, who runs a clinic for severe asthma sufferers in Letterkenny University Hospital. She's introduced a new biological infusion therapy.
In majority of patients, it's still mild disease. But let's not forget that in Ireland, 1 person per week still dying from asthma. There is a range of new biologic treatment, which are injectables. So you're dealing with the cause of symptoms. This injection is either once a month or once every 2 months.
We'll just give it here maybe in the left arm, if that's okay.
I went from going out with my friends every weekend, playing football 5 nights a week, to just lying in bed all day. And that was kind of it. This has made a brave difference here. Where I am now, I wouldn't even know I had asthma, really.
I had never had a night in hospital ever until this started about 8 years ago. Before I went on the new treatment, I was sleeping on the sofa because I couldn't lie down. I would start coughing, and I was just worn out.
That's great, thanks very much.
Not everybody will be suitable for this injection, but if you find out right patients and start them on this treatment, the effect is so transformational. They still need to take their preventative medication, including inhalers, but they have their lives back.
I've just had an art exhibition. I've just taken up cold water swimming, dipping. I couldn't have done it before because of the asthma. I am now back to where I was. Yeah, it's my birthday today. I am 65 today.
Birthday, dear Bernadette.
And we're celebrating, yeah. Yeah.
You have to go out.